Auto sequence start in 5, 4, 3, 2, 1.
And now, on with the show.
My name is Monica Crane, and happiness is joy and living in the moment.
I'm Celia Groszowski, and happiness is laughing with my kids and my friends until my stomach hurts.
Okay, Celia Groszowski and Dr. Monica Crane, thank you both so much for being on the show. Really appreciate it.
Thanks for having us.
Yeah, absolutely. Now, Celia, you are the executive director at the Tennessee Memory Disorder Foundation. And Dr. Crane, you are the medical director at Genesis Neuroscience Clinic. Is that right?
Yes, and Tennessee Memory Disorders
And Tennessee
Clinic.
Memory. Okay, great. You both have extensive backgrounds in geriatric medicine and senior care, specifically studying Alzheimer's disease. Tell me a little bit about what some of the work you both are doing right now at the foundation.
Do you want me to start, Celia? Okay, sure. So my entire career focus has been for the care of Alzheimer's disease patients and patients affected by other neurodegenerative diseases that cause dementia syndromes. And so my training experience is all in this area. I moved to Knoxville in 2007 and started at the GAP program as well as UT Medical Center. And in 2017, I started the clinic, Genesis Neuroscience Clinic, which we are gradually renaming to the Tennessee Memory Disorders Clinic. And it's been my life passion. So it's my sole career focus. I love caring for patients with neurodegenerative disease and being part of families and someone's journey.
Excellent. And Celia, you've worked with seniors for a long time as well. You've several memory care or adult daycare centers, right?
Right. So I got my master's in counseling about 16 years ago. Before that, I was working with traumatized youth, and in grad school shifted to working with the geriatric population and really fell in love with that population and have spent extensive time working in day centers directly with people with diagnoses and also their caregivers and families. It's really my passion to work with caregivers and provide support and education to them. And now working with the foundation, I think it's really marrying two populations that I love, the young people that intern at the clinic and the patients and their caregivers. So, yeah.
Excellent. And was there a moment in life that kind of brought you to this career choice, or did you, by working in different areas, as you mentioned, Celia, did it kind of get you in tune with the senior population? Was there a moment maybe in life that you knew that's what you wanted to do?
Well, for me, I always knew I wanted to work with vulnerable populations. And I saw my mom, although she stayed home with my sisters and she volunteered with the special ed students in our schools and taught them swimming. And she was always the one bringing lunches to kids that she knew didn't have lunch that they needed, or giving rides to kids that were walking to school too far. And I just always saw her reaching out to people in need. And I think that had a big impact on me. I absolutely loved working with youth for a long time, but when I started my own family, it was difficult to continue that. And I happenstance upon this job in grad school through Jewish Family Service in Denver, Colorado. It was just a 6-hour-a-week job working with people with Alzheimer's. And I fell in love with it. And I was offered to write some grants and grow the job, and I was able to do that. So I've been with that population ever since.
Well, my grandparents were extraordinarily influential in my life, and so I always gravitated towards older adults. And part of my mom's culture, she's Vietnamese, is a reverence towards seniors. So you're a higher social status by your age. So the older you are, the more important you are. It's quite interesting. There are different pronouns of and basically titles based on your age relative to the other individuals. So there are multiple ways of saying cousin. You title people either, let's say a female would be either a cousin, an aunt, a great aunt. So it's quite fascinating. And so I think I loved being around my grandparents, and they taught me so much about aging and challenges with aging. My grandfather did die of Alzheimer's as well, but my grandmother was cognitively intact until the day she passed.
Do you wish that's something you mentioned in Vietnam and other countries? I know it's similar with the respect we have for our elders and our seniors. Do you wish that we were more like that in our country? It seems I see a lot of it. Just almost seems like they're, oh, they're older, throw them away. There's no purpose anymore. Do you see that in society now? And does it bother you or worry you?
Well, I think that the culture around Alzheimer's is changing, but I think the difference between these different cultures is that the language is built around the respect for older adults. So it's rather ingrained in your speech. So maybe we can change the way we look at older adults and change the words that we use. I think that's the power of language and communication. So part of it is trying to change the landscape and the perspective of the you versus me. I think there's still that idea of, oh, that Alzheimer's patient, rather than thinking about, well, actually, it could be me too. So maybe we can shift that. You can't quite change our cultures, but I do wish and believe that we will start shifting as we continue to shift in terms of our population age. The mean age is changing, so maybe it will shift.
I'd like to get both of your opinions on this. Do you think we're going to continue to see these issues as our population now are living longer and there's more treatments and medication for whatever ails you, basically? And as we get older, do you think that those issues, cognitive issues, are going to be on the increase?
I think we're already seeing the rise. Unfortunately, there's a shortage of providers in this area. So part of the problem we're trying to address is mentoring young people to find this area and discover this area of caring for patients with Alzheimer's disease and the other dementias. So we have a robust internship program. We have currently 28 interns, and I think that's part of the solution, is to bridge the gap between our young people and older adults. And rather than focusing on trying to convince existing doctors to change specialties, perhaps focusing on the young people and inspiring them. And we just need a few to go into the area to really have an impact, given the shortage of providers. So in terms of the numbers are really staggering, and the shortage in this area is really something. Our wait lists are fairly long. We have over 6,000 active patients in just this one practice. So we would love to see more providers in this space.
What would you think? What's the reason there are not as many people going into that specialty? Or is there a reason?
Well, there are several reasons. One being reimbursement. The reimbursement is low. So the people that are in this space are this odd bunch. We're just a bunch of people that really love caring for older adults. And so in terms of the geriatricians, the joy and happiness surrounding your job is great. So we all love our jobs because we really actively selected it. The downer is when you have a lot of student loans, it really isn't a lucrative field at all. So you don't accidentally fall into this field. You have to want to actively do it. It's like a lot of service fields where there's a high need but lower pay. You have to want to do it. If you don't want to do it, then you're not going to end up in this field. So yeah, I think it's just inspiring people to find the joy in it.
That's so important, and it's a good thing to know that people that your doctors and care providers are, that's what they chose, so they are in it for the right reasons, right?
Sure.
Celia, welcome back, by the way. this technical issues are crazy.
I got kicked out.
I know you got kicked out.
Yeah.
I promise I didn't do that. You've worked a lot with.
No, it's okay.
You worked a lot with families and senior daycare facilities. Why is it so important for people with cognitive decline to be around others and to be active? What effect does that have on their disease progress?
So it's like any other stage in life. We need to have connection. We need to be with friends, with people we feel safe with, that we can enjoy. And with these diseases, a lot of times their world just gets smaller and smaller and smaller, and that extends to the caregiver as well. They're really focused on managing the disease and all the changes that come along with it and all of the behaviors. And when someone with a diagnosis is able to go to a day center or a program, or they're around others that are possibly having similar experiences, it allows them to let their guard down a little bit and participate in activities that really help with their activities of daily living. So it maintains some of their cognitive abilities, physical abilities, being able to eat in a social setting, exercise, enjoy music. But the most beautiful thing that I saw really were the friendships that everyone made, whether it was between the participants of the program, the volunteers, the staff working there. And in the day programs that I've seen, it's just like Dr. Crane said, everyone that's there is there because they're just truly in love with this population and want to make a difference. And so it's really always a very hopeful, uplifting environment. And then the flip side of that, the caregivers are able to have a really needed break. There's a book called The 36-Hour Day that is kind of the caregiving Bible and really describes what it's like to be a caregiver. And it's not that, you get 36 hours in your day. It's more like a 24-hour day requires 36 hours of work packed into it. And so for them to have the ability to get a break to take care of their own health, the other thing that we know is oftentimes caregivers' health declines more rapidly, sometimes even than their loved one, because of the stress and the burden. So for them to have the opportunity to take care of themselves and the rest of their lives is really crucial. And just like a shortage of geriatricians, there aren't that many day centers in Tennessee. There's only about 40.
Is there anything on the horizon as far as maybe anything, state money or any programs that could create more day centers, or anything that you've heard so far?
There is. I have seen that there's a pilot program in Tennessee where they will pay for the day programming, because currently it's not paid for through insurance. So folks would either need to pay through long-term care insurance if they happen to have a policy that covers it, or out of pocket, or some sort of scholarship program. And so the fact that it's not reimbursed by insurance again doesn't make it as much of an incentive for people to have day centers. Most of them are nonprofit, and because someone has a passion for helping these families.
I don't think you're ever prepared to have a family member go through something like this. But as I mentioned, my brothers and I are going through this with our mother. And one thing I wasn't prepared for was the heaviness of not only logistically trying to get to doctor's appointments and everything like that, but just the heaviness of seeing her go through this and her losing her memories. And the sadness of decline and her sadness of she is in a memory care facility, and it's just, I don't know. I wasn't prepared for that sadness and the guilt that comes along with when you get to the point where you can't care for this person 24 hours a day and you realize they need a step up in care. It's so hard. Do you all have any advice for families that maybe have just gotten that diagnosis or are going through this on how to kind of maneuver that? Celia, you mentioned one of the biggest things I think is taking care of yourself, making sure that you're prepared and healthy enough to take care of that person.
So when I work with caregivers, especially in support groups, guilt comes up every single time. We try to tackle that as far as trying to get it to leave the conversation as much as possible, and understand that, like, no one has 36 hours in a day. No one is prepared for caring for someone in this space and how difficult it can be. I think sometimes caregivers have expectations of themselves, or maybe societal expectations that you should be able to do it all and do it all very well and have the perfect caregiving plan, or my loved one will stay at home the whole time, or, this is plan A. And so we try to talk about having realistic expectations of us as human beings, and everyone comes to the table of caregiving with different tools or different strengths or different gifts, and they're all very different. Some people might have a lot of financial resources but struggle with their own mental health, and that shapes how caregiving will go. So that's what I really encourage people to do. Take a really honest look at what your strengths are, what you're able to do, and understand that your loved one wouldn't expect you to sacrifice your health, your resources, your future, and that, building from the strengths that you have and get the support that you need, and whether that's a memory care or whether that's a support group or a day center, and not going it alone, because that's really what I think puts people at most risk and most peril to struggle with caregiving.
It's very difficult to maneuver. It's for everybody, I think, involved. Definitely. Dr. Crane, for some people who may not know, what is Alzheimer's exactly? Is it a form of dementia? Is it linked to dementia? Can you kind of walk us through that?
So the word dementia is a nonspecific term to describe symptoms. So I don't like the word because it doesn't mean much. It's like saying I have generalized cancer. Your doctor would never say you have a general cancer. They would describe a very specific diagnosis. I just got back from the international meeting, and they are slowly changing the definition of Alzheimer's from a symptom disease to a biologic disease. And this will likely take away a lot of the stigma, because part of the stigma is this idea of the dementing person versus a disease that causes clinical symptoms. So the biologic underpinnings of Alzheimer's, we find plaques and tangles on autopsy. So in 1906, Alois Alzheimer's found this in a series of cases. And this is the backbone of the disease, why it happens. We know that some people have genetic predispositions, some is environment, some is both environment as well as genetics. So it is a disease of both amyloid and tau specifically. Each of the different neurodegenerative dementias has a different type of protein clump. So Lewy body disease and Parkinson's disease both have something called synuclein, or a Lewy body. They're both actually part of the same family. So we're really trying to focus on the plaque and tangle story, which gets away from that stigma. And as the new treatments are emerging, the hope is tremendous. I mean, it has been the most awesome year for Alzheimer's. The first fully FDA approved drug occurred in July of 2023. We now have a second drug. There are so many in the pipeline. We now have blood tests to detect Alzheimer's. Whereas in my training, we were taught it's only autopsy. And you can imagine if you could only diagnose a cancer until an autopsy. Well, you're not going to get very far. And that's pretty depressing. So the hope is now like, wait, we can diagnose in the live, healthy person and get ahead of the disease. It's still very scary to have any neurodegenerative disease. It's not like you're happy to get a cancer diagnosis, but if your doctor said, hey, we detected a stage 1 cancer, it's kind of like saying, well, maybe you have a stage 1 Alzheimer's where it's really mild. We're going to really fight it. You barely have any symptoms or maybe no symptoms. And I think that is something that will shift the whole conversation to saying it's a disease that has clinical symptoms, but less focus on that dementia stage. I think sometimes when people hear Alzheimer's, they go straight to that terminal patient rather than thinking about someone like you and me. Like, I could have Alzheimer's right now and not know it. So it starts off as an asymptomatic disease. So we're really trying, eventually we're all going to be screened for it and then maybe get treatment before we even have our first symptom, which is so exciting. So I think that's where it's giving a lot of positivity and hope to the field.
Now, how early with this blood test, how early can we detect?
As early as someone having just very mild symptoms, mild enough that you might still be working, but you're having a little bit of impairment in short-term memory, or maybe another area, maybe some word finding. And I'm not talking about data. Do we all have like moments where we're like totally forgetful or can't find those words? So it's okay. But I'm talking about something where you're like, you know what? Something is not quite right. It's not just a bad day. It's something is really not there. And at that stage, individuals actually have self-awareness. So that really mild preclinical stage, the blood tests can detect it. Again, this is brand new. They were just approved in 2023 towards the tail end. So they're just being rolled out now. It's a game changer. We also have spinal fluid that we can find changes even early. The blood test is going to be a little later. The spinal fluid, you can detect disease likely in somebody with minimal or no symptoms.
Wow, that's incredible. Based on what we used to do, be able to.
Yes, exactly.
Even with these new drugs and new procedures, are we talking about, is Alzheimer's curable, or are we just slowing it down to maybe, patient outlive the condition?
So ultimately, nobody cares what their brain looks like at the time of their death. Like, who cares if you have Alzheimer's plaque and tangle? But if you have no symptoms, you've lived a great life. So the goal is, if you can break the disease, it's not at this time, I don't think we can't reverse the damage, but if you put the brake on it to the point that you don't have any symptoms, you go 5, 6, 8, 10 years without any symptom, it buys you the time. And especially if you're older, let's say you're 80 and it's bought you that time, or even 70 and it's bought you 10 or 15 years. So in a way, to me, that's curable in the sense of, even if you do have a little bit of progression by the time you're at the end of your life, a little mild impairment isn't that troublesome. But we're trying to me, the cure means not like everything is gone forever, just like a lot of cancers. Cure doesn't mean you will never, ever have a cancer again. It sometimes means like we're putting this into remission. So I do believe we'll get to the point where we give people a remission period that is longer and longer. So I do think the current drugs do buy a number of years of remission or slowing the brakes on the disease. So that's just beyond hopeful and exciting, which then shifts our opinions of the disease, because we now all want treatment for something that will buy us great time.
Yeah, absolutely. Are we talking about, when you say slow it down and remission, we're not talking about regaining memory. It's just basically stopping it where it is, correct? And then slowing it down. Okay.
Yes, we're talking about really breaking the disease and the progression so that you can be sort of static. Yes, you will continue to have short term memory loss, but remember, in our brain, it's kind of interesting. The area that's so important for short term memory, the hippocampus, is really tiny. It doesn't take up a lot of brain space. Our brain doesn't really care about short term memory. Short-term memory is most of the time we forget everything. So think about it, like if I asked you, what did you have for breakfast? You probably know. Now, if I asked you, what have you had for breakfast for the last 10 years? You've tossed that out. Nobody knows. Well, I hope you don't know that. And so we purge a lot of our information. So we keep the important salient pieces. So you can function with very little short-term memory. You can use other devices, you can use calendars, apps, phones. We can outsource that, but that higher function, that's the part that we're trying to preserve in Alzheimer's. We're not so concerned about the short-term stuff. And I think the other scary thing is the progressive nature. Right when you've probably experienced this in your family, where right when you think you're like, okay, we can cope with this stage, something shifts. And I think that change, that is the part that's so scary, is the decline. It's not the initial deficit, it's the continued decline.
Right. If we can stop that, that's going to be a game changer
Yeah.
for sure. Celia,
Absolutely.
does that excite you in your work? I mean, to know that that's around the corner and all of these new procedures and new medical treatments. What does that do for you? That's going to be a game changer for some of your folks, right?
Definitely. I have, since living in Knoxville and working in this field, been hearing Dr. Crane speak for many years, and to hear the way it's changed and very recently the more exciting things that are coming out, and to be able to now be in a space working with Dr. Crane and all of the students in the clinic, and join all of the information that I have that's more of the social emotional information with learning the more medical side is extremely exciting. And it gives me such a greater understanding that I can then share with the caregivers that I'm working with. And I know that it gives them a lot of hope and meaning as well. One of the things that I think is so amazing about what's going on in the clinic is that you can see that the patients and the families truly feel like, because they have this access to the students and the interns, and they're a part of their path in education and going into this field, that it adds meaning to their disease and meaning to their journey. And not that, like Dr. Crane said, not that anyone would be excited to get the diagnosis or not think it's a big deal, but it just means something to them to think, well, if I'm having to go through this, thank goodness I'm in this wonderful space where people are learning and have a lot of hope, and I can contribute to this young person's path in life. And the way that Dr. Crane presents the information when she speaks, or when she's working with the students or talking to the families about all the new drugs and treatments and hope on the horizon, it really, I think, uplifts people. It's a different feeling. It's not all doom and gloom. It is, that feeling of meaningfulness and hope for the future. And adding some of the things that we're adding with the support groups and the diagnosis workshops, I think really gives them a holistic approach to what they're going through.
Yeah, I think it's been always such a, I don't know, it's like, I don't want to say death sentence, but when people hear that, a lot of times I think it comes from the unknown and people don't really know how to handle it. But if you're told a family member has Alzheimer's, it's almost like, oh my gosh, well, that's it. There's no more, and it's over. I think if the more that we can talk about it and have these discussions about what we can do and what's around the corner, I think it kind of, I don't know, it kind of lifts some of that doom and gloom and fear from not only the patient but also the family members around them, because we all make poor decisions when we're worried or scared. And I think if the more we have clarity on that, I think it's better for everybody. Do you think that people, I guess more advice for someone going through it, it's not the end of the story. People can still live happy lives and have joy, right? Even if you're diagnosed with Alzheimer's, it doesn't mean your life is over.
Well, of course, I think that there's so much meaning, and I think it's important. We all love to reminisce. When we talk about what makes us happy and our moments of joy, most of us describe certain memories. A lot of times those memories aren't necessarily even recent. They might be very poignant memories from our childhood. And someone that's experiencing short-term memory loss might remember those really special moments from the past. And there's joy in telling stories. And so I love hearing stories. So part of the fun and part of what we expose the interns to is the joy of listening to someone's life story. And I think that honoring someone's past is really a beautiful thing. And yeah, joy and sorrow sort of go hand in hand. So sometimes we also see, as part of this very challenging disease, we see families working together in such a beautiful way. I find it just incredible. I can't even imagine. Some of these families are going through such difficult times, and you're like, wow, people are pretty incredible. It gives you a lot of hope for humanity. You're like, people are just good. And so that's the cool thing to see. And it's not all depressing. I think that's what there's a misconception that this is all depressing, but it really isn't. And I think we can celebrate someone even that has cognitive impairment.
And the way I look at it, I think everybody has something. As we get older, we're going to have something we have to deal with, medically, or so. It's just a matter of how do you manage it. And I think everything is like that is manageable if you have, like you said, the support group and people to tell you that we constantly have to remind our mom that life's not over. There are good times ahead. So, but it's difficult, but it's such an important conversation to have. I think we need to put out there more of the facts and what science is doing for this disease, because I think if we do some of these things that you're talking about, I think it's going to be a game changer for so many involved.
Yeah, absolutely. And I'm glad that you're reminding your mom that there is hope. And the other thing about joy and happiness is most of us feel joy in the moment, in being present. And so regardless of what disease you have, you can be present. And so maybe there are some blessings. You're not as distracted by the mundane. You start to value like this moment where you're just having a blast with your family, even if you forget it. Most of us do. Like I said, most of us actually forget most things. So we're all on the same spectrum. Someone with Alzheimer's forgets a little faster and more, but we're all forgetting. And so our favorite moments are literally moments where we're doing almost nothing. Maybe I had a conversation with my boys last night and we stayed up late just chit-chatting, and it was amazing. They're teenagers, so I was like, they're wanting to talk to their mom. This is so cool. Right. So those are the things, those are the moments that you're like, this is really great. You're present. You don't have your cell phone in front of you. And I think that's the beauty of life, when you realize that it's not all about disease.
That's lessons for, I think, all of us, no matter what age you are, what you have going on. That's great lessons for us all to take home. I think what's interesting is what you said about story. And Celia, have you witnessed anything where people will tell stories to someone maybe in cognitive decline, and it maybe triggers things that they haven't remembered in a long time? I'm sure you've seen some great examples of that.
Oh yeah, oh yeah. I think the most powerful things I saw in day services were when animals came, when we had animals come to visit, and um, you would just have people talking about their dogs from their childhood. Like Dr. Crane said, it really is those childhood stories that are so wonderful. And we had this one sweet lady who rode horses as a child, and she, you could see someone who may not talk a lot throughout the day, and then an animal would come and suddenly they're very animated. They can remember a lot, very rich stories. And she talked about how she would sneak her horse down to the creek where she wasn't supposed to go. And, you could just see that twinkle and that little mischievous look in her eye. And you could see she was right back in that moment. And animals and music. And, I always encourage families to play music and pull up music from back in the day. And I oftentimes would have family members say, "Oh, he's not going to take part in the music. He will not sing. So is it okay if he does something else during that time?" And lo and behold, everyone would be up singing and dancing and taking part in the music, because it just makes us feel good. I think music is one of the best treatments for these diseases. And also going back to, you said something about the burden of the doctor's appointments and the heaviness of that. And a simple suggestion that I make for these families is, because even for the person with the diagnosis, they look at their calendar and that's all that's on there is these doctor's appointments. And so I just encourage them to put every single day, maybe 5 o'clock happy hour, even if it's not, drinking wine, you're sitting down and having a little snack and you put some music on, or, 10 o'clock walk. So adding those fun things in, those simple pleasures that Dr. Crane is talking about, maybe they have lost some of their abilities to drive and work out at the gym or do the accounting for the family anymore, but you can add in those simple pleasures. And I always encourage them to put those on their calendars so that the day has other things to look forward to, and it kind of pulls that, that heaviness out of what life starts to revolve around. And it reminds you to, okay, let's do that.
That's a great idea, yeah, because you don't want them to think, "Oh, my life is only doctor's appointments now," and that's kind of where I am. One thing I wanted to ask too, like, because I've always been curious, what is that about our brains that you can pull things from the archives, but it's hard for you to pull things short term? Is that usually what happens, and what causes that? And my mom can remember something that happened when she was, like you mentioned, Celia, like as a kid. But if you ask her, yesterday, something that we had told her, several times, she couldn't recall that.
So most of our memories, our long-term memories, are just snippets. Some people say, "Well, I remember everything from childhood." The truth is we only remember these very specific episodes. So we don't remember every single day of school that we've ever gone to. We remember maybe stories around that, stories we've told ourselves, stories that held importance, whether they be good memories or bad memories. And so our brains hold on to those. Specifically, unfortunately, our brain does hold on to bad memories a little bit better than the good ones. So you have to be careful because some things can be triggering. But emphasizing those good memories is great, but it's stored throughout the brain. It's not one place. The area that's called the working memory area, like the hippocampal region, the entorhinal cortex, is this area that's deep within the middle of our temporal lobe, which is above kind of our ear, is that short-term memory. Remember what I said, like we are constantly purging memories. Our brain's like, "Hey, do we keep this? Do we get rid of it?" And that's why when you go to the doctor, they'll ask you to remember these 3 random words that have no importance, because our brains can only hold on to that really mundane information for a short period of time. They're not going to ask you to remember those words until the next doctor's visit. It's really a few minutes later. Our brains can't really hold on to it more than that. So even with normal memory. So it's like if I were to give you a string of numbers and say, you have to memorize this, you might remember it, but you're not going to remember it tomorrow and the next day and the next day. Now your social security, you do remember. So yeah, we hold on to those episodes, but get rid of a lot. Now, folks generally do not forget the negative, particularly more recent negative events. So someone in milder stages of Alzheimer's might still remember that Dr. Crane revoked driving. That's one that's not super popular. So those are the kinds of things. Yeah. So we'll take the heat for that sort of thing. But that's an example of something where an individual does remember a visit.
That's a big one, the driving thing. That's huge for sure. Yeah. All right. Well, what do you both, we'll finish up with this question and I'd love to hear from both of you. What's your hope for the senior population as we go through some of these exciting trials, and then also for families and friends who are trying to maneuver this as well? What do you hope for them?
I'm hoping that we continue to marry the young people with older adults. I think creating that intergenerational bridge is part of the solution. And so I think at our clinic, having all of these young people be inspired to be in this area is actually inspiring to me personally. I find there's a lot of energy, a lot to learn from another generation. They're quite a bit younger. They could be my kids. And so it's really inspiring to be around the future. And so my hope is we'll see more people go into this area and find joy in this area. I think it's always going to exist, just like cancer will always exist. So my hope is that we have more people go into the area. There's more hope. There's more resources. And I think that the future looks bright.
What about you, Celia?
I think my hope is something you mentioned before, which is that people will become more comfortable talking about it and reaching out for support and reaching out for help, even with the people they're close to, asking friends and family to help, talking about how it truly is to experience it. I hope to hear more people with the diagnoses talking about it too. I think it's a very scary and still, a lot of stigma around it. But I think when we have our workshops and the patients come along with their caregivers and they ask their own questions and they talk about their own experiences, you see how empowering that feels. And I just hope we have more of that people grow to be more educated and access more resources and feel comfortable talking about it so that it's less scary and less stigmatized.
Excellent. Well, thank you both. I think it's something that the more we talk about, the better it's going to get. And I thank you both because it's been a great conversation and I've learned a lot, and I hope other people encourage people to reach out if they need help or have any questions. Where can people find you both if they do have some concerns or want to find out more about what you do?
So our website is tmdf.org, which is Tennessee Memory Disorders Foundation.org. And I think going on to the website and finding our contact information is probably the easiest way to do it.
All right. Well, thank you so much. Thank you both. It's very kind of you to come on, and I think it's such an important conversation. So thank you.
Thank you so much, Jason, for having this. It's been really an honor.
Absolutely. The honor is mine. Thank you.
Happiness Sold Separately is created and hosted by Jason Hensley and is produced by Makash Films. Music by Soundstripe. Narration by Lauren Gobis. If you or someone you know is in crisis and needs immediate help, call the National Mental Health Hotline at 866-903-3787. We would be honored if you would rate, share, and subscribe. From the entire Happiness Sold Separately team, thank you for listening.